Hi, so today we'll discuss some dialysis exam questions and answers. First question is, if the patient dialyzer is being reused or reprocessed and the volume drops below the standard of 80%, the following will most likely occur. Option A, KT over V and URR will improve. KT over V and URR will not change. Option C, KT over V and URR will decline. Option D, URR will decline but creatinine removal will improve. 20% loss of total cell volume or fiber bundle volume correlates with only a 10% loss of clearance because the higher velocity in the remaining functioning fibers leads to an increase in average diffusion rate within each fibers. To allow accurate measurement of these changes, total cell volume should be measured before the first use and during each subsequent reprocessing. So the correct answer is option C, KT over V and URR will decline. Second question, the best way to ensure that your documentations on the patient's flow sheet is complete and accurate is to option A, document properly at the end of your shift. Option B, do your charting as soon as possible. Option C, keep notes at the patient's bedside and chart them at the end of the patient's treatment. Option D, makes notes throughout the day on the worksheet, then refer to them as soon as you document at the end of your shift. For documentation, you should follow 6 rules. Rule number 1, get it done on time. Rule number 2, make it legible because everyone should read properly without any mistakes. So make it legible. Rule number 3, get your abbreviation straight. So abbreviation can pose another type of pitfall when you deviate from standard uses. Imagine a caller trying to figure out if ARF means acute renal failure or acute respiratory failure, or if PE stands for pleural effusion or pulmonary edema or pulmonary emboli. So to avoid such confusion, be sure your group establishes a list of abbreviations that everyone agrees to use. That way, your documentation will support the diagnosis code. Rule number 4, beware of charting by exception. Most of our dialysis made a standard format, but you should document if you find anything exception that not in our chart already. And rule number 5, don't leave anything out. So make sure all your flow chart is completely filled, don't miss any columns. Rule number 6, be careful when making changes. Keep in mind that the medical records is a legal document and should never be altered. If you need to change or add to the patient record, write an addendum with the date of the patient. Never write over an original entry or make it unreadable. Instead, if there is an error in a chart, draw a single line through the portion you are correcting. Keep the original entry legible. Sign and date the deletions and state the reason for making the corrections above or in the margin. Document the correct information on the next line or space with the correct date and time referring to the original entry. Correct answer is option B, do your charting as soon as possible. The next question is, to minimize morbidity or mortality rate in the CKD Stage 5 patients population, the national standard for the adequate hemodialysis prescriptions KT over V is option A, more than 0.8, option B, more than 0.4, option C more than 1, option D more than 1.2. The correct answer is option D, greater than 1.2. Next question is, according to American Heart Association, when performing CPR in adult, the correct compressions ventilation ratio is dash compression and dash breaths. So option A 15:2, option B 15:1, option C 30:2, option D 20:1. The correct answer is option C 30:2, 30 compression, 2 breaths for adult. For pediatric it is 15:2. Next question is, peritonitis is often caused by organism found option A in the eyes and mouth, option B in the nose and on the hands, option C on the exit site and the tunnel, option D all of the above. So let's discuss about the preventions of peritonitis. Often peritonitis is associated with peritoneal dialysis is caused by germs around the tube's catheter. If you are receiving peritoneal dialysis, take the following steps to prevent peritonitis. Wash your hands, including underneath your fingernails and between your fingers, before touching the catheter. Clean the skins around the catheter with an antiseptic every day. Store your supplies in a sanitary area. Wear a surgical mask during your dialysis fluid exchange. Talk to your dialysis teams about proper care of a peritoneal dialysis catheter. So the correct answer is option C on the exit site and the tunnel. Next question is, the major communicable blood-borne pathogens seen in dialysis unit include all of the following except option A hepatitis B virus, option B hepatitis C virus, option C human immunodeficiency virus, and option D tuberculosis. The correct answer is option D tuberculosis. Next question is, the recommended protein intake per day for the hemodialysis patient is option A 0.7 gram per kg per day, option B 1.5 gram per kg per day, option C 2 gram per kg per day, option D 1.2 gram per kg per day. For stable maintenance hemodialysis patients, the recommended protein intake is 1.2 gram per kg per day, and for the chronic peritoneal dialysis patients it is 1.2 to 1.3 gram per kg per day, because in peritoneal dialysis we can expect some protein losses. So the correct answer is option D 1.2 gram per kg per day. Next question is, heparin is what type of medication? Option A anticoagulant, option B antihypertensive, option C anti-anemic, option D vitamin. The answer is option A anticoagulant. Next question is, which of the following is a largest needle? Option A 18 gauge, option B 20 gauge, option C 25 gauge, option D 27 gauge. The gauge refer to the inner measurement or opening of the needle. Needles are routinely available in the various of gauge sizes, including 15 gauge, 16 gauge, 17 gauge, etc. The needle gauge becomes a consideration when the vein of the patient is narrow, fragile, or superficial, like first cannulation. In such cases, a gauge size with a larger number, example 17 gauge, may be preferred over the routine needles gauge, example is 15 or 16 gauge, to minimize damage of the blood vessel. Needle selection is very important in dialysis because improper needle selection and blood pump speed may lead to hemolysis. However, with a larger gauge size comes a smaller bore or a smaller internal diameter of the fistula needle. When the blood pump is forced by high blood pump speed with force blood to enter into the needle, and hemolysis may occur. So the correct answer is option A 18 gauge. So as you see, The picture is here. Question is, the organization that set the standard for hemodialysis water quality is called. Option A, AAMI. Option B, JCAHO. Option C, KIDOKI. Option D, USRDS. Correct answer is option A, AAMI. So please go through my previous videos about abbreviations and terms in dialysis. Question is, albumin is an important test that tells about the patient dash status. Option A, adequacy. Option B, anemia. Option C, bone health. Option D, nutritional. For monitoring adequacy, we will use KTOV and URR. For about anemia, we will use hemoglobin, ferritin, and transferrin saturation. For bone health, we will use calcium, phosphorus, and PTH. So nutritional status, albumin, we can use as an indicator. So the correct answer is option D, nutritional. Next question is, healthcare providers in hemodialysis unit can minimize the risk of being infected with blood-borne pathogen by option A, proper hand washing technique, option B, using universal precautions, option C, proper disposal of sharp, option D, all of the above. The answer is option D, all of the above. Question is, chloramine exposure during hemodialysis may occur. Option A, hemolysis. Option B, hypernatremia. Option C, pericarditis. Option D, bleeding. Correct answer is option A, hemolysis. So here we have a table about symptoms and possible water contaminants. So aluminium, chloramine, copper, zinc may affect anemia, and aluminium fluoride will cause bone diseases, copper, nitrates, and chloramine, hemolysis, calcium and sodium, hypertension, bacteria, endotoxin, and nitrates, hypotension, low pH and sulfate, metabolic acidosis, calcium and magnesium, muscle weakness, aluminium, neurological deteriorations, bacteria, calcium, copper, endotoxins, low pH, magnesiums, nitrates, sulfates, zinc, microcystine. These all will cause nausea and vomiting. Microcystines is also cause visual disturbance and liver failure. Aluminium, fluoride, endotoxins, bacteria, chloramine, and microcystine will also cause death. So the correct answer is option A, chloramine exposure will cause hemolysis. Next question is, which type of hemodialysis vascular access comes closest to fulfill the criteria of an ideal vascular access? Option A, AV fistula. Option B, cuff tunneled central venous catheter. Option C, prosthetic graft, and option D, AV graft. The answer is option A, AV fistula. So please go through my vascular access videos for the more details. Next question is, your patient's complains of mild to moderate pain in the access limb. The limb is noted to be cooler distally and paler than the other limbs. The patient states that the pain increases in the intensity while he is on dialysis. The patient could be experience option A, recirculation, option B, infection, option C, Still syndrome, and option E, black blood syndrome. So the correct answer is option C, Still syndrome. I will explain. So look at these pictures. So it is showing few anastomosis between artery and vein of the fistula. So first one is side of the vein and side of the artery, the side to side, and the second one is side of the vein and end of the artery, the side to end. Is also side of the artery and end of the vein is also side to end, and the last one is end of the vein and end of the artery. In these situations, we may expect stealing of blood into the vein and artery, because it will reduce the blood supply into extremities. So that's will call steal syndrome. Next question is, a major cause of aneurysm and pseudoaneurysm in an AV access is option A, infection, option B, inappropriate use of tourniquet, option C, not rotating site, option D, recirculation. For cannulation, we have two techniques, step ladder method and or site rotation technique, and another one is buttonhole technique. So buttonhole technique in cannulating at the same site every time, that will cause weakening of the blood vessel, and blood vessel will swell or bulge. That condition will call as aneurysm. We have two types of aneurysm, true aneurysm and pseudoaneurysm. So what is the difference between that? So we'll explain. Our vein have three layers, as you know. One is tunica intima, tunica media, and tunica adventitia. So tunica intima is inner layer, tunica media is middle layer, and tunica adventitia is the outer layer of the vein. For a true aneurysm, all the layers will affect and that will bulge. So for the pseudoaneurysm, only the tunica media and tunica adventitia will affect. So there is a difference. Now look at this picture. In this even site rotation technique also, technique with same area, that also leads aneurysm. So practice the best method to help to protect our patient access and improve quality of life of the patients. So the right answer is option C, not rotating site. Next question is, the water softener removes the following substances. Option A, sodium chloride, option B, calcium and magnesium, option C, chlorine and chloramine, option D, iron and heavy metals. So look at this table. It shows like what is the functions of each components in the water treatment system. So multimedia depth filter will remove particles natures. So softener will remove calcium and magnesium, because water hardness is due to the presence of calcium and magnesium in the water. So softener will do ion exchange method with sodium and replace the water calcium and magnesium. So if you replace the calcium and magnesium in the water with sodium, so that will make the water soft. And carbon tank have a granular activated charcoal in it, so that will adsorb the chlorine and chloramine. And polishing filters, that will filter the particles with 1 microns. And UV irradiations, so UV lights will kill the bacteria, and RO unit will remove everything. So like remove ions, bacteria, heavy metals, endotoxin, and microcystin. So the right answer is option B, calcium and magnesium. Next question is, the high venous pressure alarm occurs in all the following circumstances except option A, infiltrator venous return, option B, dislodged arterial needle, option C, needle resting on the side of the vein, option D, kinked venous line. So an infiltrator venous return, that will increase venous pressure. So that is not the right answer. So dislodged arterial needle. So dislodge the arterial needles will decrease the venous pressure because there is no resistance. A needle resting on the side of the vein, that also will give a resistance in the flow of the blood, that will increase venous pressure. And kinked venous line also will increase the venous pressure. So the right answer is option B, dislodged arterial needle. Next question is, the part of the cell wall of the bacteria that when released can cause fever in a hemodialysis patient is option A, endotoxin, option B, nucleus, option C, red blood cells, and option D, transferrin. The right answer is it is endotoxin. The part of the cell wall of the bacteria is endotoxin. Option A, endotoxin. Thank you for watching. Stay tuned. More points we'll discuss on next episode.